Hello everybody, my name is Sophia Parsons. I constructed this anatomical model with a foam head for Michael's and acrylic paint as well as candy, which you will see in a little bit. I'm going to talk about the facial muscles as well as some of the facial bones. So first off, in blue we have the frontal bone, posterior to that in pink we have the parietal bone, inferior to that in green is the temporal bone, and posterior to all those in dark blue is the occipital bone. We also have the sphenoid bone right here in yellow. Right here we have the zygomatic bone, which is also known as the cheekbone. Right here is the mandible, which is also known as the lower jaw. Above the teeth right here is the maxilla or the upper jaw, and we also have the nasal bone right here. So I'm going to now talk about the facial muscles. Fair warning, if you have a major sweet tooth or love sour candy, you may want to look away. So these are the facial muscles. I'm going to first start out with the orbicularis oculi in yellow sour rope. This inserts into the eyelid and is responsible for blinking and squinting. Down here in blue sour rope is the orbicularis oris. This inserts into the angle of the mouth and is responsible for closing and protruding the lips. Back here in green and yellow fruit by the foot, we have the masseter. This inserts into the ramus of the mandible and is responsible for elevating the mandible. Also in rainbow sour tape deep to all these, right here is the buccinator. This inserts into the orbicularis oris and is responsible for compressing the cheeks. So for elevator muscles, we're going to start off right here in pink sour tape, if you can see that. This is the levator labii superioris. This inserts into the orbicularis oris and is responsible for elevating the corners of the mouth. Superficial to that, in blue sour tape right here, is the zygomaticus minor muscle. This inserts into the upper lip and is also involved in elevating the corners of the mouth. Lateral to both of those, in orange sour tape right here, is the zygomaticus major muscle. This inserts into the angle of the mouth, and shocker, is also involved in elevating the corners of the mouth. Finally, in green sour tape, we have the rhizorius. This inserts into the angle of the mouth and is responsible for drawing the corners of the mouth side to side, like that, I think. So for depressors, we have in red and black fruit by the foot, we have the depressor anguli oris. This inserts into the angle of the mouth and is involved in depressing the corners of the mouth, like that. Medial to that, in red and purple fruit by the foot, we have the depressor labii inferioris. This inserts into the skin of the lower lip and is involved in lowering the lip. So finally, medial to both of those in pink bubblegum tape, we have the mentalis. This inserts into the skin of the chin and is involved in raising and protruding the lower lip. So those are the facial muscles and some of the facial bones. Hope you enjoyed.